name is Bea Thayer. I am the Executive Director of the Yavapai Justice and Mental Health Coalition. So the Coalition is a group of community stakeholders, leaders, community members who all have a passion towards creating a community of health and access to resources and access to services. And it was created originally to address the intersections between mental health, substance use, social determinants of health, other risk factors, and the criminal justice system. What the coalition does with the stakeholders, which is law enforcement, the jail, the sheriff's office, the community behavioral health providers, school system, social service providers such as housing, food, access to food, all these folks getting together and saying, where are the gaps in our community and what can we do to strengthen those gaps? And we look at what we call the sequential intercept map, and it takes you from prevention before somebody with a mental health or substance use disorder, before they might even come into contact with law enforcement. What do we have set up in our community for prevention so that they can access the services? What kind of crisis services do we have? Then we keep on going. What if law enforcement does come across somebody with mental health and substance use disorder? Do they have the tools with them to recognize signs and symptoms of a behavioral health concern? Does the person really need to be arrested? Is there really a crime going on? Or is this a symptom of an unmet crisis? And what can the law enforcement officers and first responders do to connect that person with our community behavioral health providers? People who are incarcerated have a higher rate of a diagnosis of mental health and or substance use disorder than the general public. And so why is that? What's going on? And is it because they're not having their needs met? Are they not getting services that they need? And it's not just mental health and substance use services, it's also housing and employment and the other social determinants of health. That's an opportunity right there then to try to work with somebody about what services that they need, what's going on with them, what can support them in getting out of jail and staying out of jail. Going through the court system are different opportunities as well, working with probation, reentry planning, and post-incarceration and post-release, what kind of reentry and transitional planning can we do to help support individuals in our community? And that's what the coalition does. It looks at it on a systemic level. There's a lot of cogs, there's a lot of partners, there's a lot of folks that do amazing, amazing work in this community. But there's a lot of different disciplines and we speak a lot of different languages. And so how do we translate that language? How do you translate the language from a law enforcement officer to a mental health provider? They're looking at kind of different missions. At the end of the day, everybody wants a healthy community, but they might get there in different ways. So how do we build those processes? Yavapai County has a lot of great resources. What happens is that our partners work really hard in their silos and they don't necessarily know how to get from one resource to another. So the coalition is there to help try to build those bridges and build those processes and help keep the wheels spinning and the cogs spinning and try to prevent people from even entering the justice system, like I said. And then if they do, how can we make this beneficial and stop recidivism, stop crime, and really try to support our community?